external expert in medical field for the Kosovo Accreditation Agency. To welcome her, I request Dr. Ruslan sir on stage. Sir, please.
Good afternoon. Good afternoon, dear students, dear colleagues. Good afternoon to everyone. Good afternoon, Dr. Jadwiga Bereska. Nice to meet you. I am Dean of Asian Medical Institute, and actually now I'm very glad to meet with you, and I officially invite you to visit our Asian Medical Institute, and we will very welcome to you in our institute.
Whole ideas to take the know-how what is going on around the scientific world and what is the amendment. So special thanks to the SB, the whole management and the student parliament, Dr. Sayyid Safiullah and the president of the student senate, Muhammad Awais. Thank you so much, guys.
Let me officially announce the end of today's conference. Yes, I want to express my gratitude, first of all, for our guest, yes, for such a nice scientific research. It really was very interesting. Thanks for students, parliament members, Awais, yes, Zubair, all other members. So it was an interesting conference, and let's enjoy tomorrow also. Thank you.
Everyone, thank you so much for attending this international annual conference on medicine and surgery. On the behalf of officials of Assistantship Memorial Asian Medical Institute and as student parliament, I'm cordially very thankful to all of you, respected our HODs, guest speakers, and our audience. So the last announcement is that for the certificate distribution ceremony, we will call you tomorrow at the end of the conference. The attendees will get their certificates of attendance by tomorrow or day after tomorrow on the same email through which they have registered themselves. Thank you so much once more.
The Medicine and Surgery Conference, and I hope today the conference will be very interesting like previous day, and actually now in our institute mostly we already have the international conference, and we invited some of the doctors from the another institutes, from the another hospitals, for the another organizations, and I think it's very big progress like for institute, like for the students, for the teachers. And I hope that in the future, you during
I'm grateful to the management for inviting me in this event. Mr. Rector, Mr. Vice Rector, Dean, Head of Departments, the dear faculty, and my dear students. I am privileged to speak on this occasion and the importance of the research and R&D in the medical universities. This is one of the important topics nowadays globally. So you see, medical universities, they play a critical role in advancing medical knowledge and improving the patient care through research. Research provides the foundation for evidence-based medicine, which is the cornerstone of the modern medical practice. This is essential to achieve this goal. So research is vital in a medical university because it fosters the scientific inquiry and the discovery. By conducting research, medical professionals can explore new avenues for treating diseases, develop developing the innovative treatments and advancing the medical knowledge. This is essential to achieve this goal. So research is vital in a medical university because it fosters the scientific inquiry and the discovery. By conducting research, medical professionals can activities, and this can be achieved through several initiatives, including the following. And I think the Asian Medical Institute is following the same trends that are needed to develop this culture. The universities, they must have the proper funding for the research projects, to promote the research activities in
on the other idea.
Please check this.
Yeah, no, it's possible. Of chest X-ray. Please understand, chest X-ray should be done in RT-PCR positive patients with high risk. So only in elderly patients, immunocompromised patients, patients who are kidney transplant patients, when these patients get an RT-PCR positive for COVID, we as a baseline investigation, in baseline, we take a chest result.
Come and join us for this conference. This conference actually has paved way to the history in making to advocate our students not only to stay indulged with the books but also to take part in the latest activities in this field. And this is a very good initiative to encourage our students to commit themselves to improve their commitment and their activities for this profession. And this conference actually is going to prove a very big milestone towards the number of achievement of our institute, and we are very much privileged to be a part of an institute where we are not only focused on teaching some relevant material, but also we are very much focused and very much keen to build our students.
Second point is the one that really bothers us because there is no single trial that has shown a significant cardiovascular risk reduction with glucose control alone. This is shocking because patients will be asking you, so why I need to offer a glucose control? Because my mortality remains the same even with the SpO2 of 10% or even with the SpO2 of 7%. My mortality is almost the same. I'm not going to have any significant difference in terms of mortality. And that is the reason why we have mandated the cardiovascular outcome trials for drugs that are used for treating type 2 diabetes right now. So remember that a drug called rosiglitazone, once upon a time we have been using rosiglitazone. In 2003, my mortality remains the same even with the SpO2 of 10% or even with the SpO2 of 7%. My mortality is almost the same. I'm not going to have any significant difference in terms of mortality. And that is the reason why we have mandated the cardiovascular outcome trials for drugs that are used for treating type 2 diabetes right now. So remember that a drug called rosiglitazone, once upon a time we have been using rosiglitazone. In 2003
market. And for DPP4, we had the Savertimi for saxagliptin, the Examine for alogliptin, PCOS for sitagliptin, Camelina and Carolina for linagliptin. And for GLP-1 analogs, we have the LEADER trial for liraglutide, Elixir for lixisenatide, Excel for exenatide, Sustain for semaglutide, Pioneer 6 for the oral form of semaglutide, Rewind for dulaglutide, and Harmony for albiglutide. Albiglutide is not available, as far as I know, in India it's not available right now, and even in the United States I feel it's not available, but nevertheless it's been proved to be significantly superior in the market. And for DPP4, we had the Savertimi for saxagliptin, the Examine for alogliptin, PCOS for sitagliptin, Camelina and Carolina for linagliptin. And for GLP-1 analogs, we have the LEADER trial for liraglutide, Elixir for lixisenatide, Excel for
I can see here many students, I'm sure that the students are in the third, fourth or the fifth year. So what I'm saying right now, for some of you, you are already going to graduate, but the research field is not limited just in the math schools. Whenever you will get graduate, please be sure to learn about the research factors because that's always going to develop you in a more good and clinical doctors and saving the patient and saving the humanity eventually. My experience being in this med schools, I'm going to share a very brief story. When I was in a second year of med school, I was really interested in writing papers, systematic reviews, meta-analysis, and right now I have more than 7 plus publications and also in the research, I have some citation. I can see here many students, I'm sure that the students are in the 3rd, 4th or the 5th year. So what I'm saying right now, for some of you, you are already going to graduate, but the research field is not limited just in the med schools. Whenever you will get graduate, please be sure to learn about the research factors because that's always going to develop you in a more good and clinical doctors and saving the patient and saving the humanity.
Speakers and enjoy to conference. Thank you.
Otherwise normal or normal asymptomatic patient having normal physical.
Focused on this period. I mean, we took as a scientific focus the most peaked time of the pandemic period, which is coincide with the cancellation of pandemic-related restrictions and curfew and current way. In some countries, they faced challenges due to economic level of economic development.
It also removes waste that babies produce as well. Normally, the baby's blood travels from the placenta to the baby and back again via its umbilical cords.
Due to the extra fluid it receives from the donor. This results in more amniotic fluid and a much larger amniotic sac. When this happens, the twins have entered stage 1 of twin-to-twin transfusion syndrome. In stage 1, there is a noticeable size difference between the amniotic sacs. In stage 2, the donor is giving away so much blood and producing such little urine that its bladder is no longer visible in an ultrasound. By stage 3, the abnormal blood flow is detectable by an ultrasound. The recipient's heart may start to show signs of not working as well as expected. A difference in size between the twins may also be noticeable by this stage, although this may be seen earlier as well, due to the extra fluid it receives from the donor. This results in more amniotic fluid and a much larger amniotic sac. When this happens, the twins have entered stage 1 of twin-to-twin transfusion syndrome.
She is a current president of IFMSA from Pakistan. She was presenting the topic on fetal surgery. Thank you so much, Ms. Saman Javed. Now I would like to pass.
We're glad to see you today. Welcome to this very good conference who provided into this. Thank you for Parliament, who organizations for us this conference. And I hope that knowledge which you get into see today, maybe in movies, maybe in presentations, help you in your practice classes, help you in your new experience in you working in futures. Thank you.
Thank you so much, ma'am.
in the session. Hope I am audible for all of you. Thank you so much. Thank you so much. Shall I start the session now, or should I wait for some time? That's great. To discuss some of the important aspects in pancreatic surgery. So I am Dr. Rajamendran, an author of Surgery Sixer, and I have completed my MCH Surgical Gastroenterology from Chennai. And these are some of my books used: long cases and short cases surgery, clinical cases and clinical cases in pediatrics. This is the most often book for PG entrance exams in Indian exams like Surgery Sixer, and we already had one book for foreign medical graduate also, but it is not so active now because of not updating for the past few years. Since we are thinking that exams are going to be combined, we are not getting updated. So this is best wishes from my hospital and from my institute and from my online platform, Dr. Dorians. So we are going to discuss pancreatic necrosis. See the necrotic material through the posterior wall. I am removing the so you can see a vault of pancreatic necrosis. We are removing now, completely removing the necrotic materials. So the necrosis can be removed through the posterior wall, because posterior to the posterior wall we have the necrotic materials. We are removing that material. So after removing that, we are doing a cystogastrostomy. So there is a picture showing you, there is a video showing you a trace procedure being done. Entire pancreas is poured out here. Now I have poured out the entire pancreas for a clear-cut anatomy. I don't know whether you can see the videos playing clearly or else. Let me show you. This is a video clearly showing you. Yes, so this is a chronic pancreatitis. This is a duodenum, C part of duodenum. The audio of the video is also available. That is a duct fully opened. You can see the chronic pancreatitis, the full duct we have opened out. Head is code. What is the name of this procedure? This is a procedure we are going to bring the jejunum mass. So the very important step here is you have to note the pouring of the head. This is trace procedure. Okay. Poured out head of pancreas. The duct is fully opened out. So now I am going to bring a jejunum and anastomose with this. Okay, this is a completed trace procedure. If I am not going to do a head pouring, it is called as what? It is called as fused. Okay. People's operation. You can see here. There is a pattern of jejunum. Jejunum I am going to bring now, and I am going to do the 3 anastomoses. I told you, the 3 anastomoses will be done now. What are the 3 anastomoses about to be done? First we will do the pancreatico-jejunal. That is first.